Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about arthritis of the big toe joint. Now, arthritis occurs in many different joints throughout the body. The foot and the ankle does see its fair share of arthritis, especially the ankle. However, in the foot, arthritis is relatively uncommon compared with arthritis of other joints within the body. The one spot that does seem to get arthritic fairly frequently and fairly commonly, however, as an exception to this, is the big toe joint. Now, the big toe joint is a very important joint in the cycle of walking. It has a separate range of motion than the other joints that are along next to it, and it takes the lion's share of pressure from walking and the act of moving. The big toe joint consists of basically two different bones. One is the first metatarsal, which is the big long bone that's located towards the inside of the foot, and the other is basically the first bone in the toe, which is called the proximal phalanx. Now, big toe joint arthritis can come about through a number of different means. Arthritis can certainly come about because of previous injury or previous fracture, which has caused wear and tear of the joint itself. But people can develop big toe joint arthritis naturally just simply because of the way that their foot is structured and sort of genetic factors that sort of create this. Factors that can create this include the big toe, or rather the first metatarsal being too long or too short, which requires the joint itself to kind of function a little bit abnormally over a long period of time, which eventually will create wear and tear on the cartilage. The first metatarsal itself can also be too elevated, where it can sit too high, or it can be too flexed down, where it can sit too low. And this also creates damage to the joint as it tries to go through its normal range of motion, in which there's excessive wear and tear on either the top side or the bottom side, depending on the position of the bone itself. Essentially what happens with arthritis, as it does in the big toe joint, as it does with all other arthritis, is essentially wear and tear of the cartilage, which is sort of the natural surface that the bones glide on in order to glide smoothly. As the cartilage wears down, the tissue underneath it is basically bone. So essentially you're getting bone grinding on bone, and that creates a significant amount of pain at times. Now, I have seen many cases where there is fairly significant big toe joint arthritis and there really isn't much pain attached to it. And sometimes that's due to the fact that once you get to a certain level of arthritis and the joint essentially freezes or doesn't move at all, then there's really no pain because the joint itself isn't moving too much and there's no bone grinding on bone. However, this can affect other joints next to it and can create a fairly significant problem during the walking cycle if this disease process is allowed to continue. Well, when the big toe joint becomes arthritic, not only does the cartilage degrade on the inside of the joint, but also a lot of spurs form around the sides and especially on the top of the big toe joint itself. When there is a lot of pain, essentially what's happening is that the joint motion is being limited, but the joint motion that's still there is basically bone grinding on bone, and it creates a lot of pain. And oftentimes what will happen is that if there's a large spur on the top of the joint, the big toe itself won't be able to flex upward enough, and as it tries to flex upward, it's sort of hitting that spike of bone that sits on the top, which is preventing it from moving further, and that can create a lot of pain as well. Treatment for big toe joint arthritis can vary. There are non-surgical treatments that can be entertained, just like there's non-surgical treatments that can be entertained for arthritis in other joints, such as hips and knees. These can include injections of steroid medications, although typically the big toe joint is fairly small and injections aren't necessarily that effective. Arthritis medication can also be taken to limit the amount of inflammation of the remaining joint tissue. But given the unique nature of the big toe joint and its movement required during the walking cycle, oftentimes this doesn't work that effectively either. Certain types of inserts called orthotics, which are especially made around a mold of the foot, a custom-made device which is made of a mold of the foot held into a corrected position, can limit the amount of joint motion if some special modifications are made to stiffen up that area. And that doesn't take care of the arthritis, but at least makes walking a little bit easier. Surgery is the best way to treat big toe joint arthritis, especially in the later stages, as well as in the early stages too, when it's just beginning. Surgery can vary. There's lots of different procedures out there, and each surgeon has their own preference regarding which procedure they like to entertain. Excuse me. Early cases of arthritis are essentially treated with removing the spurs, remodeling the joint a little bit, and trying to restore some form of cartilage not quite the regular cartilage used, but something called fibrocartilage, which the body can produce once the regular cartilage is destroyed, which can help bring about some range of motion and can restore the functioning of the joint in early cases. More significant cases may require either the use of an implant, which can be very different designs. You can have implants which can cover both sides of the joint. You can have implants which just form the cup of the joint or the ball of the joint. And generally these are fairly successful and have been used for quite some time. It is actually my personal preference to use joint implants initially. Finally, if that doesn't work, or if the arthritis is fairly severe and there really isn't much bone or joint space left to be able to accommodate the use of an implant, the great toe joint actually has to be sort of fused in place. And this is a very successful procedure in which the joint is completely removed and it is fused in place where the bone becomes one solid mass. And there is no more pain because there's no joint that has to move about. Now it does stiffen up the big toe, and it doesn't flex as it should most normally during the anatomic cycle of walking. However, there is no longer any pain, and the foot is still very functional, and one can certainly walk and do majority of the activities that were done before, with the exception of things like squatting and other activities that require a lot of bending of that toe itself. Well, I hope you enjoyed this video. Look for more videos on all things foot and ankle on this site as well as others, or you may look at my website at www.inpodiatrygroup.com. Thank you.